Hi, I'm Kristen, and I am 46 years old. And about a year and a half ago, I had an artificial disc replacement and a corrective spinal fusion with Dr. Charles Theofilos. About 5 years before I met Dr. Theofilos, I was a single mom with young children, aged 6 and 4. And one morning I just woke up and couldn't feel my right arm and my right leg. I was in excruciating pain. Went to the doctor and they said I needed to have emergency spine surgery. So I did that, and they did a discectomy and fusion and put a plate in my neck. After that surgery, they told me that it was successful given that I could then feel my arms and legs, but I never felt quite right after that, and my quality of life was horrible to the extent that I couldn't do the things with my children that I wanted to do because they were so young and they were getting involved in sports and other activities. I couldn't participate like the other moms, and I was a practicing attorney and couldn't spend a full day at work focusing on what I needed to focus on because of the aggravation and just the distraction of the pain. So I knew at that point that I needed to find some other answers. When I first met Dr. Theofilos, I came in and they did some x-rays and other tests, and I started to explain to him how I felt, and immediately he began finishing my sentences for me when I would say, and when I do this, and then he would say, you feel like this. So I immediately trusted him because I knew he understood exactly how I felt physically, and it was difficult for me to kind of reach that point of where you're just out of answers and you're looking for anything. And coming here and meeting him and meeting his staff, and they all treated you like family. As soon as you walked in, I was comfortable enough to make that decision to have a second surgery. And for most people, I think that would be a really hard decision to make, but once I spent some time with Dr. Theofilos and his staff, it was a no-brainer for me. So as soon as I had the surgery, I was in the hospital, and it was right around Thanksgiving time. And I remember I was so impressed and so honored that Dr. Theofilos actually came to the hospital on Thanksgiving Day to come visit me. And since the surgery and since the disc replacement, I'm back to work full-time as an attorney. I am doing more and more with my children. I'm traveling. I do more with my husband and my family, and I'm just generally a happier person, and I'm really glad that I took the steps to take care of myself. The x-ray showed that everything was progressing and healing normally, and to me, that's just a testament as to how well he does his job, how skilled he is at his craft, and how when he tells you what he's gonna do and how it's gonna get fixed, he's confident, and I'm confident that I would refer him to any one of my friends at any level, whether they're young or old, or in what level of pain. At least try to get the answers, or at least try to stay ahead of where you are. If you know that you're not feeling well, I would say just go see Dr. Theofilos, have him look at you, develop a relationship, and if it's not the time, he's not going to tell you that it's time until it's time. And you'll know, and your body will know, and he'll be able to then answer your sentences like he could answer mine. And just having that relationship and connection with a doctor is so rare these days that I found it refreshing, reassuring, and ultimately have developed such a respect for Dr. Theofilos and his team.